Hello, I'm Dr. Sharda from LBR Dental Implant Center. We are located in Hyderabad, India. If you are planning to travel abroad for dental tourism, especially to countries like India, this video is a must watch. Today we are discussing basal implants, an implant system which is often advertised as a graftless, affordable, fast solution even for patients with severe bone loss. This might sound appealing on the surface, but it has its own limitations and risks that is often mentioned. Let us start with the price myth. Basal implants are often marketed as a cheaper solution for full mouth rehabilitation as they are single piece implants and they do not require additional components like multi-unit abutments. But what is often not disclosed is that basal implants for full mouth rehabilitation require 12 implants in the upper jaw and 10 implants in the lower jaw, which totals up to 22 implants. Whereas all on 6 using CPBCCI Protocol, as the name mentions, require 6 implants in the upper jaw and 6 implants in the lower jaw, which totals up to 12 implants. Even if we factor in the cost of the multi-unit abutments and other screw retained components, it is much lower than what the basal implants cost. So the basal implants is a cheaper version, or it costs lower, does not hold up under scrutiny. Now let us talk about the design flaws. Basal implants are single piece implants. That is the reason why they cannot be angulated properly. If the placement is off or not straight during placement, then the implant has to be bent at the neck, compromising the structural integrity of the bone and the implant as well. On the other hand, two-piece conventional implants allow us to use multi-unit abutments, which provides far more precision in alignment and ensuring that the final process looks and functions naturally. From the biological perspective, the difference is even more significant. The basal implants, when placed in the bone, they just mechanically bind and they do not biologically integrate with the bone. On the contrary, conventional implants, when placed in the bone, they fuse and biologically integrate with the bone, which is a true osseointegration, providing proper stability in the long run. Another major concern with the basal implants is that they are cement retained. Cement retained means the processes is fixed on the basal implants with the help of a cement. During the fixation, if any excess cement seeps into the gum, it leads to a serious gum infection called peri-implantitis, which can even lead to implant failure. Another major problem with the cement retained teeth is if there is any damage in the teeth, say a chip or a crack or a wear and tear in the long run, removing the cement retained processes is almost impossible. The entire ceramic framework has to be cut into pieces, and in the process the surrounding bone can get damaged and dislodge the implant. In such a case, an implant cannot be replaced immediately as the area will take months to heal. In comparison, all on 6 with CPBCCI Protocol supports screw retained process. If there is any damage with the teeth can be simply separated by loosening the screw. The same process repaired and refixed in a day or two. And finally, it is very crucial for international patients as basal implants are not FDA approved and are not practiced in countries like US, UK and Australia. If you face any problem with the basal implants back home, the local dentist will refuse to treat you. That is the reason why at LBR Dental and Implant Center, we practice only globally accepted implants and we fix teeth in less than a week without subjecting you to any additional surgeries like sinus lifts and bone grafts. Hope this video helps you make an informed decision regarding the full mouth dental implants. If you have any other query regarding the screw retained teeth or immediate loading of teeth using universally accepted conventional implants that are FDA approved and CPBCCI Protocol, you can book a free virtual consultation by logging into our website or WhatsApp us on the number provided below. Thanks for watching. Namaste.